Ladies and gentlemen, welcome to Radivision, the new Entrepreneurship Network, and welcome to another episode of Stories Live. Today, we have our guest, Leon, the founder and CEO of Oxitone. Leon, welcome to the show.
Thank you very much. Thank you for inviting me. I appreciate it.
Of course. So we're here to highlight the heroes of the startup world, specifically those that are working to help us fight this, pandemic and what's going on in the world. And so, Leon, tell us a little bit about yourself. Give us a quick intro of what is Oxitone and what are you working on?
I am founder and CEO at Oxitone Medical, and I'm inventor of the world's first FDA-cleared pulse oximetry monitor at wrist. What does it mean? It means that all technology was in the market before was dedicated to some kind of fragmented care. So a patient could measure, but measure once a day or once a week. You can have some picture about patient, but this picture is fragmented, episodic, so it's not wonderful picture. And we decided that today technology could allow to make some applications and devices that really could help high-risk patients with very chronic diseases, I would say, with very tough conditions, to help to monitor these patients like in hospital, like in ICU, every second at home. And this is was our main goal. So we created such a monitor, we created all infrastructure around, and I managed this company for the last 10 years.
That's awesome. So just so everybody understands, and I at first didn't understand either, what it is, for those of us who have ended up in the hospital for breaking a leg or hurting ourselves somehow or being sick, it's the little thing that goes on your finger typically that monitors your vital signs in the hospital. But you've now taken it to the next level and you've created almost like a Fitbit for it.
Okay. Actually, it's not Fitbit. The main difference...
like a watch.
Yeah. People, sometimes even investors, I talk a lot of investors and a lot of customers, they confuse wellness devices with medical. Even if you go to, very, very big companies doing some market reports, they all confuse between medical device and wellness device. And the main difference that if your physician get data that was generated by Fitbit on your wrist, physician can throw this data on the basket. They cannot prescribe based on this data. They cannot make care plan based on this data, because if something happens, he is in charge of this. But if it is based on data generated by a medical device, it's totally different story. It's like in hospital.
Right.
And before, continuous monitoring was possible only in hospital, and we extended these capabilities for home. So patient today, if patient just in acute stage, even they don't have to go to emergency room, they could get this device, get home, and continue hospital-grade care out of the home. This is a true hospital at home that we were one of the first entry into the hospital at home.
Awesome. I think what would help our audience is that we have a small little video that we can show so everybody can visualize what this actually looks like. So let's show the video of the Oxitone wrist oximeter.
Good.
That's awesome. Every time I watch the video, I just think about how interesting it is to take something that has been used all over the world for many years, and
50 years.
50 years, and then come up with a new version that just makes so much sense, right? Like the fact that you've functionality-wise changed it, you're basically giving the ability to be monitored at home, and I'm assuming not just cost factor for hospitals and insurance, but there's so many benefits. And so maybe that's where we should start. How did this get started in your mind? Like, what was your inspiration to work on this?
I think it's based on whole history of my self-development, because I went through all stages of personal and professional development. But my background is kind of simple. I have PhD in physics, specifically in optics and quantum electronics. And then I spent time on building quantum computers. It's a hot subject. It was 15 years ago. It was a very hot subject, and still today very hot subject. And once I was lucky to meet, so I was a scientist that time, and I was lucky to meet then my good friend, my first mentor. He is a great engineer, and he introduced me into medical industry, into medical area. And he said, you know, I remember his quote. He said, you know why scientists have so low income? Because what they do, they could use only in 50, 100 years. Now take all this salary and cut it on 50 years. You will get salary of scientists. So,
yeah.
And I understood that if I want to make difference, if I want to introduce something new in our world that people could use today, not in 100 years, this is what I have to do. And I just left science and became freelancer optical designer. So I spent some years to help many companies, specifically in medical device area, to develop unique sensors and unique devices. And learn a lot there. So from scientist, I broke in my hand, I became engineer. It's a totally two different type of thinking and mental stage, or a mental stage, I would say. So, and in 2009, something happened. My father collapsed on the street after 3 hours, being 3 hours after discharge from the hospital. I called to his physician, and physician said, I don't know anything. No. Who knows? I don't have any data. I saw him recently. He was well. I don't know what happens. Let's bring him here. We'll see. He is alive. He's still alive. He's 93 years old. But this is what happened. What happened 10 years ago. And I was very frustrated, actually. And I understood that something wrong. Why it happens? Nobody. I know exactly. For example, people could monitor oil pipeline every second. People could monitor something every second. Why we cannot monitor our loved one if they're really sick every second?
Right.
And I have all technology in my hand. I have all skills in my hand. And I decided that I checked different type of medical devices, and I pick up specifically pulse oximetry, because we were very close to develop this unique technology. But you know, it's interesting. If you just move the same sensor from fingertip to the wrist, nothing happens. You cannot measure just as it is, because at wrist you have a lot of different type of blood, a lot of muscles, all these stuff that just deteriorate the signal. So we found very unique place. We call it ulna place, ulna bone. There is a ulna bone here. By the way, this is the device. There is a ulna bone where you can meet all requirements to measure correctly. And what's interesting, all of the world was busy with wellness devices, Fitbit, others. So people didn't want to think about medical, but medical device. This is where I think we can really make difference, because we can really save life. It must to have, it's not nice to have. I want to have wellness, I want to run and understand my heart zone. This is what I want.
Leon,
but for patients, this is what I need. Yeah.
let me ask you a question. So just, again, we're telling the story of the journey, right? Like, would you say that you were born as an entrepreneur?
No.
No. So
no, I wasn't. I wasn't at all.
Right. So you were a scientist, transitioned
I'm from science.
Right. And so then, like, that process of that moment when your father collapsed and you having that, what I call the aha moment, and Alexei Ohanian from Reddit talks about the 4 a.m. syndrome, where you wake up at 4 a.m. and you can't stop thinking about how you want to change the world, right? And that's and how many people's lives you can change. What was that experience like for you, as far as really even coming to that realization that that was your mission or path? You know, after spending so many years in science and engineering and developing products for other people, tell us a little bit about that moment for you when you self-nominated yourself as an entrepreneur.
Okay, it's exactly what happened. How do you know? So in the morning, I came to one of my friends, and I was one of his consultants that time for development, and told him, look, his name is Ilya. He's quite famous in the medical device area. And I said, you know, I have some idea. After what happened to my father, I understood, I was thinking what we can do, and I have some idea why we cannot move a very bulky and annoying device to the wrist and make it continuous and make it comfortable, so people at home could wear it 24/7 and deliver data every second to physician or to remote patient monitoring company. So based on this data, it's possible to predict, because we have a high resolution of data every second. So you can extrapolate, you can predict, so you can avoid any disease deterioration or something like this. And he said, wow, it's very interesting, but it's very difficult. Nobody did it before. All devices that time were episodic. Blood pressure monitor, these devices, all episodic, just one-time measurements. If people should be very active to do it. And he said, but it's very difficult. So we start to think how to do it the best way. We figure out where to do it. We figure out what should be configuration. It's interesting that it's something unusual configuration, because our sensor is flexible. Just imagine, you know Apple, yeah? It's very rigid sensor, so you just press your hand here and it doesn't move. And our sensor always flexible, it's elastic. Imagine, yeah? So it moves all the time together with the hand. Right. Moves.
When you had that conversation initially, did you, in your back of your mind, think about, okay, how many people's lives you can affect? Like, how many people are there that could benefit from wearing one of these devices? How many lives can you actually save? And again, we're not even talking about Corona yet, or COVID, right? We're talking 10 years ago when you got started. What was the, people have these slides about the addressable market. How many lives did you think you could impact or save?
Yeah, this is one of the first things I started to investigate, the market. We call it market, market capabilities. And we understood that actually this extension for patient monitoring after discharge from the hospital, this is what happened to my father. So I started to look at the market from the point of view how many people discharge in the United States, for example, every day. And we start thinking about readmission rate, and the readmission rate also impact on some death rate, mortality rate, and we figure out some number of people whom we can really help. But most important, not how many people, most important, who are these people?
Right.
And these people are most vulnerable population. It's elderly people who cannot make active engagement in their healthcare. Everybody, we hear about behavioral change. Let's engage our patients. And this is somehow echo from our approach that was before COVID.
Right.
Our approach for average patient. It wasn't device specifically designed for low-risk patients and high-risk patients. It's the same device that was using for all type of patients. But it will take into account, if we think about patient of disease third, fourth stage, or some end life, they cannot be engaged in their healthcare at all.
Right.
They wanna spend time with their kids, not with their disease.
Right.
And here we are. So we empower care of patients with very severe chronic diseases. So we give them capability to be passively monitored. So peace of mind, we put on them device. It's not only pulse oximetry today, we added much more vital signs. And finally, we're going to put all spectrum vital signs into the wrist, including blood pressure. But actually, it was what was before, we put device on these patients, and that's all. For a couple of days, patients doesn't have to do about anything. Data flow automatically to the physician, automatic alert based on artificial intelligence capabilities. So alert is not annoying, it's very, very deeply analyzed alert. And that's all. Patient connected, like in a hospital, and patient happy.
Right. So this is all, again, before COVID, right? So I'm assuming your vision was that someday every patient that was discharged from the hospital would take one of these home and would be monitored, and thereby decreasing their likelihood of falling like your father, right? So that was your core mission. What version are we on of the product? Is it 4.7?
Yeah, it's a second version. We got FDA in 2017.
Okay.
And today there are another two companies having FDA for pulse oximetry at wrist, and they used us like a predicate. And we got to the market a year ago, and currently we have second version, much smaller, and we are working on the first version that is even much smaller. But we're not going to stop there, because for some patients who cannot wear it at wrist, the best way to wear it here. So we developed some version that enables to wear on upper arm, and signal is very stable. And also we are in the beginning of development of ring. You know, Oura ring, yeah? Oura ring is not medical device. It doesn't measure anything except pulse rate and something like this, yeah, and sleep also, wellness. We're talking about world first FDA cleared pulse oximetry monitoring, even more at finger, but very small device. Not only for sleep apnea, there are some devices for sleep apnea. This device for 24/7 everyday measurements. So we apply our unique technology. We have 5 patents and 30 patents worldwide granted, and we apply this technology to different places. So actually, it's unique technology that doesn't affect the blood flow, local blood flow. So data is very much accurate. And if you take a look from medical point of view, accuracy is most important thing. And this is what we succeeded to do.
So you were on this path. You had a product that shipped, you had clients, you had people using it, and then COVID hit. What went on in your head when the pandemic started to hit? And, what were your thoughts as far as really now, I guess, turbocharging your go-to-market strategy? Because all of a sudden now, the number of people who are going to be hospitalized and could be helped or saved with your device skyrocketed, right? So what went on in your head, and how did the team react to the pandemic and your strategy?
Yeah, interesting. When you just take a look on different startups, it's written everywhere: pivot, COVID-19 pivot to COVID-19. And I think we're the only company that didn't change anything, because our product was designed it looks like specifically for COVID-19.
Right.
Because, yeah, our product, I'm not talking about device, also whole product, continuous monitoring platform, was designed for patients with acute respiratory failure. It's COPD patients, I mean, pulmonary disease patients, it's heart conjunctive patients, it's some, and COVID came with exactly the same outcome. Respiratory failure, this is outcome. So we didn't have to change anything. Even our questionnaire would not rely only on objective data. You know, physicians like subjective data as well. They like to ask patients, how do you feel, what do you want? So we integrated this together, and this dramatically enriched our capabilities. And symptoms, we didn't change even symptoms, because symptoms for patients with pulmonary diseases and with COVID, they are more or less the same. We added something about pain, but we had chest pain, for example. We added just general pain. Good. But actually, we didn't have to change anything. We applied these as it is.
Have sales gone through the roof, or are you doing more deals, or what's
Oh, that's interesting. Not through the roof, because it requires a lot of marketing. So people just do not know us.
Right.
This is first. Second, we're talking about alternative. We don't have direct competitors who can. We have competitors who say, okay, we have a chest patch with ECG. Now let's use it or pivot for COVID-19. I don't know how it's possible, but okay. But a real alternative is an old-fashioned technology for fingertip.
Right.
This is alternative. And people everywhere use it. So, for example, one of the main problems of COVID-19 is silent hypoxia. It was written a lot of papers about this. Silent hypoxia, when oxygen saturation is very low, function of lung is very low, but it gets compensated by high heart rate, and people do not feel it, and they could die in a couple of days.
Right.
And so it's still questionable if they need continuous monitoring, that's quite costly, or $30 pulse oximetry monitor here is enough, spot check monitor.
Right.
But what I understand, and people start to understand, definitely they start from very low cost solution, but it didn't help. So they come to us. So it's growing. So people more and more approach us and ask for continuous monitoring. Not a lot of companies today apply continuous monitoring. They still have some kits for specific diseases, including COVID-19. And these kits will just temperature meter, pulse oximetry like non-in, blood pressure monitor, all episodic, once a day. It's not enough. In our case, it's not enough. And that's why one of the biggest companies who integrated our product into their COVID-19 kit is Ascom. It's one of the biggest European telecommunication company. And they were first who integrated our product into their specific solution for monitoring COVID-19 patients at home.
Leon, how much is the device?
$300. Again, it depends. But I open secret, $300.
And so I noticed artificial intelligence plays a role in all this, because, again, I think the monitoring is great, but you're trying to create efficiencies. Tell us a little bit what role it plays and how it's integrated into the product.
Currently, let's start from my understanding of artificial intelligence in medicine. Except in imaging, I do not believe that, for example, you will go to make surgery based on what a robot told you. Are you?
No.
So I'm not sure that in the next 50 years, at least, people will accept a decision and the diagnosis made by artificial intelligence and make something based on this diagnosis. So I would call it augmented intelligence. So it helps physicians to decide. And this is what our platform actually is doing. We deliver some answers based on these data. So we deliver answers about whether deterioration happens. We add analytics and some machine learning to create specific alert. Because, for example, let's compare with conventional fingertip oximeter. You get measurements, you get oxygen saturation very low, all people around you are busy to help you.
Right.
But it could be because you just moved quickly or weather is no good, but it's not a complication. It's just a random effect. But it happens, and people busy, get to the emergency room, and finally you pay copay, insurance company pay, everybody's busy, and everything is costly. In our case, we put specific alert based on 5 levels of validation, and each level just based on artificial intelligence tools. It's investigate patient behavior and patient what happens before, and just after that we have alert. When we introduced this to our platform, alert decreased about 90%.
Wow.
Yeah. So what I can say that 90% of alert that happen today are false alerts.
90%.
90%. This is from our experience.
Right.
And people busy around these alerts. And even more interesting stuff we figure out. We made some clinical trials of people who are really sick and people who looks like sick. You know the difference. There are some people very compliant who appear in an appointment all the time, every day call physician and say, oh, I feel bad. And just guess, whom physician pay much more attention? These people. And physician unconsciously think that have to help these people. They are very annoying. They're very ill. And some people have different type of character, yeah, different type of mood, and they die slowly and quietly, or twice a year in the hospital. So we talk to these patients and compare their baseline. Our technology enables for a week to build patient baseline and then make it like a benchmark to compare with all progress of disease.
Right.
And we build the baseline. And what happened? And our physician was very, very surprised about. This guy who physician told is very sick, very bad condition. All the time pay attention, call to this guy, was totally healthy. Totally healthy. What problem he had? Stress.
Was it psychosomatic?
In our baseline, we show stress as well.
Yes.
And he had a very high stress. He was very stressful.
Yeah.
But all other stuff was very good. Pulse oximetry, lung function, heart rate, everything is okay. And this guy who was quite, silent, he didn't have stress.
Right.
He was very sick. All the time it was a jump of oxygen saturation. The main problem that changed. It's not the problem of all the time low oxygen saturation. The problem is just jump this oxygen saturation based on patient activity. So if activity just makes some jump of oxygen saturation or pulse, it's a problem. So function of lung is very low. And they have, so he was very, very sick. It surprised our physician. So our healthcare is not optimized, and continuous monitoring that we deliver just revealed this. And COVID-19, what COVID-19 did? COVID-19 did very good thing. One very good thing. COVID-19 just put attention of all people on elderly and vulnerable population.
Right.
Very much. On nursing homes, what happened in nursing homes. So I expect that it will be money released and it will be a lot of new solutions how to help these patients. Otherwise, we cannot name our society like human society.
Right.
We have to help these people.
I read that it's being used in nursing homes, and we've been reading a lot about the patients and the struggles in nursing homes. Tell us a little bit about how it's being implemented there and what you're doing with the monitor there in nursing homes.
Yeah, it's very interesting experience because it's very challenging. And I like challenges, like entrepreneur, you know. First of all, it's very elderly people, 80, 90 years old, and they are really sick. And what we figure out that as much patient sick, as much patient get used to this. And this is the main problem. Yeah. So, okay, I will die soon. I don't want to bother myself wearing something or something like this. So compliance quite lower than conventional patients, about 50%, I would say 50-60%. But we succeeded, so we found how to do it. Another challenge is that nursing home doesn't have infrastructure for continuous monitoring. So we have to train them, we have to follow them all the time, help. So we spend a lot of time with our first nursing home. But actually, when we deployed these, it wasn't any death. So the main beauty of using continuous monitoring technology in nursing home, that you can close all nursing home in quarantine and just watch this patient out of your healthy and secure office. That's all.
Right.
And if, for example, nobody coming to check this patient, everybody is just inside, and you have all these data, you can help, and you don't have any problems. Right. The problems today, first of all, you don't know what happens. You have to get in to check it, and this is the main problem why COVID-19 impact nursing home very much. And by the way, what's important, we can deliver our application to patient family. So from the home, patient family could watch patient data, not patient, elderly data out from the home. That's something new, something they don't have to go to this. To the patient, they can watch.
That's for the peace of mind, right? I mean, just to know that being monitored. I think we talk about stress, and I think if you have a parent that's in a nursing home, I'm sure I don't, but I'm sure people are just stressed out and they just want to know that they're okay. So I think that peace of mind is priceless. What are the survival rates in nursing homes, and what's going on as far as hospitalization rates and people there? Like, how severe is it?
Actually, currently we stopped monitoring this nursing home because they don't need it anymore. That's okay. All people okay. So we deployed it 3 months ago, first time there, and it wasn't any death and any hospitalization from that time, because you can watch what happens and to make some preventive things before. So that's important. So we can catch up with data. We watch sleep apnea, sleep data, stress data. So we can all the time we were busy with understanding what happens. So it was our first nursing home. Currently, we are working with nursing home in New York as well, and we plan to introduce our product into another 2 nursing homes here in Israel, for example, and in United States. And actually, our device is working in nursing home in Europe within the some offers kits of our partners there.
What's your goal? What's your plan post COVID? Where are you going to be in 5 years?
In 5 years?
Yes.
That's an interesting question. First of all, we plan to extend our capabilities, and finally, I'm going to put all vital signs from the hospital shelf on the wrist. That's important. And also have some ideas, new ideas, what really we can do. One of the ideas, we're going to enter into precision medicine business. That sounds very interesting. And we can monitor and also enter into pharma business, because we can monitor patient disease drug-specific response. So just, for example, you take the drug, and immediately your body tells you and somebody else about what happened, how drug influenced. And if you didn't take the drug, your baseline changes, and immediately a lot happens about your compliance.
Wow.
And I think that it's very interesting. And now we're talking with some CRO and pharma companies using our product for second and third stages of drug development, clinical
So
trials.
during like trials to be able
Trials, yeah. Any trials, what happened today, you don't have real-time data from the patients. So that's why some trials just fail in phase 3, because they don't have capabilities to collect data out of the phase 2. In our case, in phase 2, you collect all, you build the baseline of this patient, and immediately you can say that these baseline changes this way or that way, and you can compare with drug specific impact, and you can say how drug impact of this specific guy. And this is, I would say, it's some precision data you get about this patient, and you have very personalized understanding, personalized drug influence on this patient.
That's awesome.
This is the future.
What are your thoughts? What's going to happen with COVID? Do you think there'll be a vaccine soon, or will
I do not believe about vaccine soon. You remember when AIDS came 40 years ago, people were crazy to create vaccine. Finally, no any vaccine. And what I was reading, COVID-19 has a similar features. I don't know. To me, all stories about vaccine, this is only something about to make some story, or people really believe in this. But until real vaccine will come to the market, it's difficult to say. What I believe in drug against, or some cocktail that will help to overcome this COVID-19. This is what I believe.
Do you think there'll be herd immunity, and it will just be like the regular flu?
If there is a drug, it could be regular flu. But the main problem, I'm not big expert, I'm not biologist, but what I understand, if COVID-19 influence and have some post-COVID influence on patient body, it could be it could have very bad consequences. So much better, much worse than any flu.
Right, it's crazy
for some people.
Yeah, it's crazy times. We have a few questions from the audience, so maybe we transition to that. I know we're running a little bit late here, but this is so interesting to me. I just think, I love entrepreneurship, and I respect and then congratulate people who are building stuff that's not another video sharing app, and they're actually having an impact. So again, we want to congratulate you on doing something that means something. And maybe in 10 years or 15 years, I'll ping you and ask you, so Leon, how many lives did you save, and how many people used the oximeter? And you'll tell me some crazy number. But let's go to some of the questions from the audience. So how effective is Oxitone's solution in the prevention of congestive heart failure?
It's not effective in prevention. Ineffective on prevention of exacerbation of congestive heart failure. We cannot prevent disease. We apply to patients who are very sick already, and actually specifically in the late stage of their disease. Because for early stage of disease, once a day, fingertip, that's enough. And for very advanced stage, our device is must. And it's effective for congestive heart failure, but about maybe 50% of time. Because not all congestive heart failure influence on acute respiratory failure, and you can measure a drop of oxygen saturation, and drop of oxygen saturation happens like result. So if COPD patient, this is first what happens with CHF patient, it could happen sometime after exacerbation happens already. So it's less effective than COVID or COPD patients, but for some patients it's important to catch up in time exacerbation as well.
Cool. Okay. What do you attribute your success to?
Thinking and learning. I learn all the time. I think all the time, and I develop my specific approach how to think and how to learn quickly. And I think because I went through all stages of professional development, I was scientist, I was engineer, I was executive, and I'm entrepreneur in executive. Maybe my next stage is investor. I don't know. I'm not there yet. I have to say that I can think from different points of view and from different dimensions, and this is what helps. I'm PhD in physics, and physics help to think and to structure data. This is what I'm doing in any things I'm doing. I structure the data.
Do you believe that we can raise our IQ by thinking and learning?
No, we cannot change our IQ.
What is your IQ?
We cannot. I don't know. I never checked it. I don't want to check it.
I'm
not sure it's so high. I'm not sure because.
Come on, don't say that. Don't say that.
I'm slow thinking, I would say. I cannot catch up in that. So I prefer to think deeply and just after that to decide. So maybe IQ is not so high, but most important today, and this is behind the success of many people I know, is EQ, emotional intelligence.
Yes.
I think today is the most important. And what's beauty with emotional intelligence, you can improve it, dramatically improve it. IQ you cannot change. IQ depends on capabilities of your memory, but EQ you could improve really.
Awesome. Okay, one more question, and then we'll cut it off. But so, when did you know you were an entrepreneur? I think we kind of talked about this, but was there a time you woke up at 4 a.m. and you looked around and said,
I think after I left my scientific career, because to look for all the time, like a wolf, to look for food all the time, like a freelancer, it's some kind of entrepreneurship as well. So I was lucky to enter into this habit, into this lifestyle, and this developed entrepreneur. And what's interesting, I can tell you what the difference. When you are a freelancer, you sell yourself all the time in a new way. And you could grow to sell yourself. You can become the great and very high or high income, great freelancer.
Right.
But when you have company, you sell only a company.
Right.
It's much better. I think it's much easy. And but at the same time, it's quite complex. Why? Because it's not only company you sell. You should deliver trust in your company, in your product, and in yourself. So actually, it's some kind of balance.
Yeah. And what's interesting is that it's constantly shifting, right? So you're having to work with the team, with the customer, with your investors, with different facets of the business, and so I think part of being an entrepreneur is this ability to. I read an article to constantly zoom in and out, and make it, like you said, decisions quickly. So yes, you're absolutely right.
Yeah, you're absolutely right. So when you talk to customer, you have to talk from one point of view. When you talk to investor, you have to show the investor have to show their dream and future. Right. For customer, you have to show what you have now. You can help now. For your team, you have to show your capability to be a leader. It's a totally different conversation. I will be happy to enter into this stuff. Maybe we'll have another discussion, not in 10, 50 years.
Yes.
Very soon, and we can touch these. I like this subject. For example, in General Electric University, there is such a thing. I took 2 courses about leadership. I like it very much because this is what behind all success. Oh, now I have answered to the question, what behind the success? It's not thinking, it's a capabilities to lead the team, because team what makes success of the company or the product, it's a team. And if you don't know how to lead team correctly, you will lose your team, you will lose your success, and you will lose your company.
Yeah, I once met the CEO of AT&T, and I didn't know he was the CEO of AT&T at the time. And we talked about what are the importance of being an entrepreneur and a CEO. And I said, you have to delegate and motivate and lead a team and find people that are smarter around you, and then hope that, you've picked the right people. And I personally love when it's under 10 people. He looked at me and said, yeah, I have that problem, except for mine is like 170 or 270,000 people that I have to, manage and motivate and hope that they do everything right every day. Leon, I think we've gone over our allotted 30 minutes. Honestly, this has been really interesting to me. I love the fact that you're doing something that right now, today, is helping people. And so again, from Radivision and from our community, we want to say thank you. We want to congratulate you. We want to wish you all the best. And again, I will check in with you periodically to see what your numbers are at. And hopefully those numbers go through the roof. And we wish you all the best. And thank you for joining us.
Thank you, Nima. I appreciate that you invite me. And I'm really happy to share my thoughts with audience. Thank you very much.
Thank you so much, Leon. Thank you so much, everybody. We'll see you on the next episode of Stories Live, and we're out. Peace.